Good afternoon, and I'd like to thank everybody for being here today. And before I get started, I want to take a minute to remind everyone that even in the midst of a COVID-19, there are still great things happening across our state every day. On Tuesday, I was honored to be with 11 first responders and 6 civilians with the Missouri Public Safety Medals for heroic and life-saving actions. I also would like to say a thanks to Fred and June Coomer from St. Louis, who recently donated $300 million to Missouri S&T, the single largest gift to a university in our state's history. I also want to give a shout out to Lincoln University that we've been working with. Lincoln University was granted pre-approval for a new law enforcement training academy, the first in the nation at a historically black college and university. Last week, I had the chance to be at the Jefferson City Airport to do Operation Thank You for our first-line responders, our nurses, and our doctors. It was great that there was people out there, that you had an opportunity across the nation that they're doing this in every state to just thanks for the frontline workers in this crisis. I also think it's important to remember most of us has had a chance as we went through this 8 months to kind of reevaluate, to rethink things and see how we would be doing. I do want to remind everybody in the state of Missouri, those frontline employees, those nurses, those doctors, those police officers, those EMTs have still continued today to fight the battle with the coronavirus. And they've not had a break, and they'll continue to do that. And as we move forward, that task will continue. So I would appreciate everybody keep them in their thoughts and their prayers, all those frontline employees that are out there every day. So these are just a few examples of good things happening all around us. Even in the middle of a global crisis, Missourians are still working together and helping one another for the greater good of our state. Speaking of good news, according to the monthly job report released yesterday, Missouri's unemployment rate dropped over 2 full percentage points, from 7% in August to 4.9% in September. And that is great news for our economy and shows that Missourians are getting back to work. Over the month of September, unemployment increased by another 13,000 jobs. Missouri has recovered 217,000 jobs, or 63% of the jobs lost to COVID-19, and consumer spending is up 6.3% from last September. Our economy is recovering. We are on the right track, and we will come back stronger than before. We continue to take a balanced approach to COVID-19 and go back to our 4 essential pillars: testing, hospital capacity, PPE, and data. As you know, we recently announced an expansion of our state COVID-19 dashboard. These dashboards build on our data pillar and provide Missourians with multiple charts, maps, measures about COVID-19 and its impact in the state. This includes public health data, economic data, social impact data, and that will help our local leaders, employers, schools, businesses, and citizens across the state better understand COVID-19 in their communities going forward. Over the weekend, the Department of Health and Senior Services recognized a technology issue in how data was being exported. This resulted in an incorrect number of new cases shown on the dashboard Saturday, which actually reflected an increase over the previous 2 weeks, not a one-day increase. DHSS took immediate action and has since resolved the issue. And I want to point out that the issue was a technology error in the system. The data was not lost, and all new cases still have been, and will continue to be reported in an accurate and timely fashion to the public. As we have said many times, we are in an unprecedented situation. DHS is working with more than 2.2 million records at this point. Providing real-time data at its quantity and its level of detail comes with a new set of challenges. However, we are working through these challenges, and just as we have throughout COVID-19, we will continue to be transparent and provide our citizens with the most accurate and up-to-date information. With that said, I'd like to give a quick update on COVID-19 data in Missouri. Over the past week, Missouri has averaged roughly 1,400 new cases per day. The entire Midwest is seeing an increase in cases right now, including Missouri. We have also seen an increase in hospitalization. But again, overall, our healthcare system is still stable and meeting the demand. Still, at 1.6%, our community fatality rate continues to show a downward trend. While we are experiencing more positive cases, fewer of these cases are fatal, which we are extremely thankful for. As far as testing, we continue to test more and more Missourians. Last week, we reached a milestone of over 2 million COVID-19 tests administered in the state of Missouri. Earlier today, we had the chance to visit Truman Medical Center in Kansas City, which will house one of the saliva-based testing machines developed by Washington University. This new technology will be a game changer for COVID-19 testing, helping us increase testing volumes even more and improve turnaround time for our results. This will be distributed to 3 other machines regionally: Southeast Missouri, Southwest, and Central Missouri. And I might point out that WashU already has one in place for the St. Louis region. On the vaccine front, we also remain optimistic as doctors and scientists continue to make progress. This will be a major global development in COVID-19 response, and I want to assure you that Missouri is fully prepared for when this time comes. Our multi-agency team has been working on a distribution plan since August, which we just submitted to the CDC this afternoon. We are extremely confident in our plan, which other states have looked into developing their own plans and using Missouri for a model. We are one of the first states to get this plan in to Washington, D.C. Today, Dr. Williams is here to walk you through the details of our plan. Dr. Williams?
Thank you, Governor. It is such an incredibly important day today for all Missourians. We're incredibly appreciative of all the work that's gone into this. Before I start that, I do want to just add that I want to thank you and all the Missourians. We are very much emphasizing flu shots. The Governor and the First Lady who've led our campaign were gracious enough to get their flu shots this week. Our preliminary information shows we're up about 20% for the month of August. That's preliminary, but we're incredibly appreciative for that. We're waiting for September's numbers to come in. That's a voluntary system. It's not mandatory. But we just think that's so incredibly important and want to thank you for pushing that message out and want to thank all Missourians for doing that. Also, for those of us who are here this weekend, I want to thank the First Lady especially and the Governor. The Capitol was lit up pink for those families and those patients with breast cancer. 1 out of 8 women will get breast cancer in Missouri. And so just incredibly appreciative for raising that sensitivity. Anecdotally, I talked to Jim LeBaron up in Adair County. They've kind of pioneered the mobile flu vaccine clinics, and I think this is the first year I haven't been up there, but he emailed me late last night and said that they were having record numbers up there. So to all Missourians, to you for helping spread our message, I want to say thank you. This is such an important day for our state because through the work of a lot of people, we now have, and you have available as of 3 o'clock, the plan that we're submitting to the CDC. It has already been submitted this afternoon ahead of schedule, as the governor said. And we will get feedback from the CDC by October 26th. But the hallmark of this plan is collaboration and coordination. We started this on July 9th. You may remember, some of you, when I was before the Senate and House in this building back in March, I said we will get to where we need to get in Missouri, no matter what comes our way, by communicating, collaborating, and cooperating. And this plan is the exemplary of that. More than 25 groups throughout the state have been on work on this. We started July 9th. We got our playbook from the CDC a month ago, but we were already 2 months ahead by that time. It represents more than 100 state employees, a whole government approach, working with FQHCs, working with hospitals, working with nursing homes, working with partners in the state and our federal partners. And so we are incredibly appreciative of the body of work that's gone into a very comprehensive, well thought out plan for when the vaccine is available. Our hope is, as Secretary Azar testified last week before Congress, that might be late November, early December, and that every Missourian might have the vaccine available to them by April. And so we continually wait on that. But one of the key of our plan is it's adaptable. You're going to have this plan. I'm not going to go through every part of it, but I want to highlight it for you as you read it. I realize you just got it at 3 o'clock when this started. And we're certainly going to be available to answer any of your questions about it. But we've been working at this, like I said, for almost 3 months, and the work streams are these. The first one is prioritization. We know that in November and December that we will have a finite amount of vaccine. There are 4 vaccines that are being developed. 3 of them require cold storage and have 2 injections. 1 doesn't and has 1 injection. We don't know which one we'll get first. But we're prepared for what comes our way. So the first thing is, how do you prioritize who's going to get that when you have a limited amount? And our North Star is always individual patients. Our second North Star is always preventing spread in the community. So we have prioritized it to do just that, to protect Missouri's most vulnerable people and to very much get this in front of our healthcare providers who are so essential to taking care of everyone. So you'll see it. People ask me, how does one go about doing that? And I always quote Proverbs, we don't lean unto our own understanding. We've worked with the CDC, we've worked with national vaccine advisory groups, we've worked with our partners here in the state, we've worked across departments in the government to come out with that. And once you read it, I hope you'll see that. The second work stream that's so important is our regulations and our financing of it. It is a free vaccine, and the syringes and the PPE and the gowns that go with it are all free. You are allowed to charge to administer it through normal mechanisms. But we are working through the regulations about who gives it and those kind of things and being very purposeful about that. So that's incredibly important. Probably the most important thing is working with the people who will be giving the vaccine. I can't tell you how appreciative I am to the providers in Missouri that we put out a survey, and 1,000 sites, and many, like Barnes-Jewish would have hundreds of thousands of thousands of doctors and nurses have indicated they're going to sign up. So they will sign up, and we will be tracking these vaccines. But I just can't thank the providers of Missouri, our FQHCs, our health departments and all, for already indicating that they'll be willing to do this. And that is a hallmark of this plan, is that we very much use what foundationally has helped us to this point, which is the doctors, the hospitals, the FQHCs, the nurses, and the health departments. That we build on those tremendously. And we do that doing regional teams, and we have a regional model. And you'll see that in the plan, and we'll be happy to talk to you more about that. And that's using the 9 SEMA regions that we have. The fourth work stream is logistics. As you can imagine, this is unprecedented, as the governor said. 3 of these vaccines require cold storage. You just can't put them in a truck and send them. You've got to send them someplace, and some of them are very much cold storage, I think 70 degrees below zero. So you can imagine the logistics that go into that. And so we have to build that out. We can't thank the Missouri National Guard to date for their help with logistical planning. That's what they do. They help with logistics, and they've been phenomenal. And so we thank them for that. But we are building that out. The fifth thing is information technology and data collection. It will be unprecedented that we will record and work out through our Show Me Vax system that we have. We will follow every vaccine. 3 of the vaccines require 2, so it's important to know who's getting it where, and that they come back a month later and get the same vaccine. So we have to track that, and we will be tracking that. And then the final work stream, this is the 6th one, that you are so vital to is communication and community engagement. It's incredibly important that we push out our messaging around safety, about efficacy when we know it, and those other issues to avail people of this vaccine that we think can empower families to take care of their loved ones, whether it's your father or your mother or your brothers and sisters. The vaccine will not be available for children or pregnant women because those phase 3 trials have not been done in that group as of now. And at this point, those, especially children, are not as vulnerable as our senior citizens are. So that we hope will come later, but not at this time. But again, our North Star is to get this vaccine to those families for their loved ones to get it. And at the same time, to prevent community transmission so that we can reduce the stress on our healthcare system. And we know that through our flu shots and these vaccines that we're able to do that. So again, to all those Missourians, the hospitals, the health departments, the nurses, the doctors who've helped us get to this point, we can't thank you enough. To all those people in the state, the governor, his chief of staff, Aaron Willard, and others, we can't thank them enough for putting in this whole government approach from a field of public health. We think it has been vital, and as the governor said, is recognized by other people as a way to go. I'm going to stop there and come back and answer questions, I believe. Great. Thank you.
Thank you, Dr. Williams. What Dr. Williams says has been an incredible collaborative effort, and I want to thank all of the agencies and the partners involved in their hard work and dedication. I do, and I think Dr. Williams will make that available, but I think it is very important for the media to know who all was involved in putting this together. From agency after agency after agency outside the state agencies that were a part of this plan. In the midst of a historic and constantly changing situation, our team of professionals have done an outstanding work to make a detailed plan. We are at a great place in the planning process and well prepared to take action as soon as this vaccine becomes available. Dr. Williams, how many pages are in that? 100 plus?
My glasses here. It's close to that. Yes.
The document that Dr. Williams showed, I think for everybody listening at home, you need to understand there's a lot of legal language in there. There's 100 pages of trying to prepare this for the CDC. Between now and Election Day, some media will utilize that to try to put misinformation into the public's eyes. And here's what I want to ensure every Missourian watching today. What that says is that we were prepared above most states in the United States with a plan. And we are going to execute that plan As soon as that vaccine gets here, just as quick as any other state in the United States, because of what we've done here in Missouri. And I think it's important to realize that as we move forward, that you understand that as today as I traveled the state, and I've traveled the state here recently, there is so many people in this state trying to do the right thing every day, working together to fight a virus, to keep the economy going. And I think we need to remember that especially between now and Election Day, that all the people are doing all the right things and the good things to help fellow Missourians. So with that, I just want to be clear on that as we move forward, especially on this. This vaccine is a huge development as we move forward to have that to the general public. And the one thing I know, we want to make sure we get it as soon as we can, and we want to do it right on that. As you know, the Missouri National Guard has played a critical role in COVID-19 response, from testing support to the establishing the alternative care sites. And keep in mind on those alternative care sites, I want to remind everybody when we thought we were going to be overwhelmed back in April, when actually a lot of the reports that 22,000 people in Missouri was going to die, that was in the headlines of papers across the state. And we thought the hospitals were going to be overwhelmed. One of the things that we did, we reached out to the National Guard and the Corps engineers, and we were able to put up a temporary hospital in 11 days in the St. Louis region. I think that is something always to go back and reflect on what we can do by working together and put our resources together to protect the people of the state. Not only that with the Guard, food distribution, and much more. The National Guard has assisted in our vaccine planning efforts, which we greatly appreciate. Today, Adjutant General Compton, who I recently had the honor of pinning to the rank of Major General, is here with us and giving an update on the National Guard. General?
Good afternoon. Thank you, Governor. And hey, it's great to be with you this afternoon. It's good to be with you to provide an update on how the Missouri National Guard is engaged and remains engaged throughout the COVID pandemic. I'll provide a little bit of information on the actions taken during restoring peace and order during civil unrest, as well as our actions in support of our nation's defense. In early March, we worked with interagency teammates to determine focus areas where the Guard could provide the most impact fighting COVID-19. The focus areas included expanded testing, food bank support, school meal program support, state workforce return to work, and general support. I want to provide a short review on each effort, beginning with expanded testing. In support of Department of Health and Senior Services, the Missouri National Guard supported testing of 37,000 Missouri residents at mobile community-based testing sites. We also tested 12,400 Missouri Department of Corrections employees, assisted with data entry of more than 80,000 COVID-19 tests, and fielded 72,000 phone calls. Currently, our largest effort is in support of the Health and Senior Services Department, providing 118 service members supporting data entry, call center operations, and we continue with our community-based testing efforts. Of these 118 service members, 60 are in fact involved in supporting the community-based testing, moving from one location to another across our state at designated areas by Health and Senior Services. Regarding food bank support, because of the pandemic, volunteer support at food banks decreased while the demand for services to Missouri families increased. The severe shortages in labor at food banks posed the potential for decreased services. The Guard is proud to be a part of this and help fill that void of labor, providing dedicated and hardworking teams to assist. In support of the nonprofit organization Feeding Missouri and local food banks, the Missouri Guard assisted in providing 181,000 Missouri families with meals. Since September, the food bank support mission is our second largest effort, with 100 service members providing assistance. Service members are located at regional hubs in St. Louis, Springfield, Columbia, St. Joseph, and Sikeston. Turning to our school meal program support, we supported Department of Elementary and Secondary Education with we helped provide 288,000 school lunches to Missouri school children. As schools have reopened, the need for guard assistance has decreased, and we're thankful. We are proud to have assisted in this essential service to ensure that those who rely on school meal programs over the spring and summer did not go hungry. In regard to the state workforce return to work effort, we supported, again, Department of Health and Senior Services with conducting medical screenings at 14 different sites across the state, screening 541,000 Missouri citizens. This effort supported our state employees' return to work to provide services to Missouri citizens. I want to talk a little bit about the general support. In support of our interagency teammates at large, the Missouri Guard provided assistance with transportation of PPE, remdesivir, and other needed supplies. Additionally, as the governor mentioned, the Guard worked with the Army Corps of Engineers, the Federal Emergency Management Agency, our State Emergency Management Agency, the Missouri Office of Administration, and local authorities to construct and staff an alternate care site in Florissant. Construction of the facility took only 11 days and now serves as a model for the future should the need arise. We are also supporting various planning efforts, including support to the Interagency Vaccine Distribution Planning Group, ensuring focused and timely distribution of vaccines once they are made available. The Missouri National Guard will continue to support our interagency teammates as long as needed during this COVID fight. With regard to civil disturbance operations, the Missouri Guard mobilized on May 30th and later on September 24th to support civil authorities in Missouri and Washington, D.C. as outside actors disrupted peaceful protest. During this time, the Missouri National Guard stood shoulder to shoulder with great teammates, the Missouri State Highway Patrol, Missouri local law enforcement, and federal law enforcement partners to protect life and property and the First Amendment right to assemble peacefully. This support occurred in St. Louis, Kansas City, and Central Missouri with 1,100 guardsmen, and in Washington, D.C. with 304 guardsmen in May. Then in September, a platoon-sized element, 23 of our service members, supported local law enforcement and federal civil authorities in St. Louis. Our response was swift due to clear executive guidance, great interagency collaboration and teamwork, and the training and hard work of our soldiers and airmen, day in and day out. Our service members carried this mission out with maturity and compassion for the people they serve. With regard to our federal mission, several of our Missouri National Guard units deployed and returned during the pandemic. We deployed our 70th Mobile Public Affairs Detachment, our 3175th Military Police Company, 1107th Aviation Support Group, all on operational missions in support of our nation's defense. We also provided airlift support to the Sabre Junction exercise in Europe. During the Sabre Junction exercise, our 139th Airlift Wing was the lead unit for the airlift portion of the operation. This is an annual event by U.S. Army Europe designed to assess readiness of Army airborne units and the interoperability of joint forces and partner nations. Currently, we have more than 700 soldiers and airmen deployed supporting federal contingency operations. I've just given a lot of data, and I want to summarize quickly. The Missouri National Guard mobilized over 1,000 members from March to July, and currently have just under 300 members mobilized to support the state of Missouri in response to COVID-19. Additionally, the Missouri National Guard mobilized 1,400 service members in support of law enforcement in Missouri and Washington, D.C., restoring order and protecting public safety. We currently have 730 soldiers and airmen deployed in support of federal national defense missions, Our efforts focus on supporting the greater team within Missouri and the United States, supporting our citizens in time of need, while being a key operational force supporting our nation's defense. These efforts are made possible through soldiers and airmen following health protocol measures and committing to something bigger than themselves. And we service members know that we're a team of greater teams who enjoy the support of our families, our employers, and our Missouri citizens. And we don't take that support lightly. We greatly appreciate it. Citizen soldiers and airmen of the Missouri National Guard are part of the communities they serve. In fact, we have 59 armories across our great state, and we have service members who in fact live in all 114 of our counties and in the city of St. Louis. We take great pride in supporting our great state and our nation. Whether we are called to assist in a global pandemic, supporting the health and well-being of Missouri citizens, responding to support law enforcement to restore public safety and protect critical infrastructure, or supporting the global war fight defending our nation, I'm proud of our National Guard members, always living the National Guard motto, always ready, always there. One team. Thank you very much.
I don't know if there's a Missourian out there that would be any more prouder than our National Guard than what I am as governor, but I'm going to tell you what, we owe these men and women that wear that uniform for all the things they've done during this time. It was well beyond the call of duty. The leadership of General Compton for what he's done to still be in the Middle East, to still do our duties in Panama, still do the civil unrest and everything they've been asked to do. Those young men and women, I want to make sure that the general tells them how much I appreciate those frontline soldiers who are out there every day, and I hope you join me as all Missourians to thank them when we have an opportunity to do that. It has been a busy but good week with several meetings and events. Tomorrow, we will be attending the Highway Patrol's Accountability Forum here in Jefferson City. We will also be traveling to St. Louis for a job announcement, another Missouri Excels ribbon cutting, and a Veterans Community Project event. When we were preparing to launch our Show Me Recovery plan this spring, I told you that our recovery would not be a flip of a switch. And that is true. It was true then, and is true now. This is a gradual process, but we are making progress every day, and we must keep up our efforts. And I remind you once again how important social distancing is, how important wearing a mask is, how important washing your hands is. If we continue to do these things and work with one another to make this state better, we will all get through this virus. Thank you, and God bless.
Dr. Williams. Phil?
I have to answer the governor's question first. It's about 112 pages, so give or take one or two, Governor.
Hi, Dr. Williams.
Hey, Phil.
Again, not having seen the plan yet, but can you walk through, I guess, those medical ethics questions of how you prioritize who gets the vaccine and how you work through that?
Yeah, I know you're going to be very interested in that. A lot of people have approached me and asked me about that. Again, it goes back to what I said earlier. We don't lean onto our understanding. We've listened very carefully to the CDC. We've listened very carefully to national vaccine advisory groups. We've gone cross-departmentally. Our North Stars are to try to get it to those people who would have the most impact on people with morbidity and mortality, to get it to those most vulnerable flashpoints, if you would. So you're going to read it, but one of those obviously would be people who work in long-term care facilities. We know that we've been incredibly appreciative that we have decreased our case fatality rate, especially among our seniors. That even though, as the governor said, we have 1,400 cases a day compared to April, when we only had a much smaller amount than that, but our mortality rate was 7%. Because of our boxed-in strategy and others, we've been able to reduce the fatalities and the morbidity. But we think a key to that, for instance, is staff who work in those facilities. So that would be the first one. And then I participated in a CDC activity about a year ago called CLADE that kind of looked at a pandemic. And if you had to ration a vaccine, who would you give it to first? And one group that clearly comes out is your healthcare providers. And the example I used at the CDC that day was if you're on a plane and everybody gets food poisoning and you only have 2 doses of antibiotics, you want to make sure the pilots get it because they've got to land the plane or everybody on the plane is in peril. So certainly one of the things motivating us is that those essential people who take care of people, whether it be in ICUs or hospitals or wherever. And then we build out from there, not knowing how much vaccine we'll have initially. So it's a very tiered system. There are 3 phases, and you'll read that, phase 1, phase 2, phase 3. Phase 1 is kind of the group I've described to you. Phase 2 is more of that group and broader. And then phase 3 would be mass vaccinations through drive-through clinics, gyms, individual providers, and we anticipate that might be more like April. So thank you for the question. And again, we are committed to being in there after you read it to answer any questions you have.
Sebastian?
Hey, Dr. Williams.
Hey, Sebastian.
So the governor touched on some of the issues that we had with the dashboard
Yes.
over the weekend and over the past few days.
Sure.
Do you worry about losing the trust of Missourians and the state's ability to handle this data? And also, are there any contractors involved, or is this all DHSS internally?
Well, to the first part, Sebastian, I guess what I'd ask Missourians to do is, I've been in healthcare for 35 years. I've been a physician, I guess now 36 years or something. And healthcare is incredibly complex. And so when you're dealing with 2.2 million records, people getting tested, following that up, and we do that every day, we understand that in any healthcare system, whether you're a hospital or public health or Medicaid, with 2.2 million, that you're going to have times where you're going to have technology issues. Our commitment to the people of Missouri, as was my commitment when I was a physician practicing, was that when that happens, we will address it just as soon as we possibly can. So on Saturday, Sunday, and Monday, Monday was a holiday, our team, including me, was looking at what happened. Immediately, we didn't think it was true. That the first thing, if I was a Missourian, I'd want to go is, oh my gosh, what happened? Have we reached some tipping point where we now have 5,000 cases? We didn't think that was true, and it wasn't. We thought the most likely thing was a technological era in which cases over 2 or 3 weeks had been aggregated, because that's happened to us before, where we have a data dump from a lab where they send us 4,000 tests over 2 weeks. And the other one was that we were getting duplicated data, that there really weren't 5,000, but it was really 2,000 people getting counted twice. So we had kind of an idea. As we've switched to these technological platforms, which have gotten us to a much better place, but I'll be honest with you, anytime there's a transition from manual to electronic, there are going to be challenges, and that's what happened on Saturday. We found out that it was the former, that it was an aggregate of cases. They were real. But as the governor said, my message to Missourians would be this. We're averaging about 1,400 cases a day. That didn't change on Saturday. That's true. And my other commitment is we're dealing with these incredible amounts of data, 2.2 million. We've tested 1 out of 3 Missourians. Our commitment is when these challenges arise, we will address them just as soon as we can, which we did on Saturday morning. So, thank you.
Hi. Is there any kind of timeline that is set for the CDC to respond to the plan?
There is. Thank you for the question. It's October 26th. It does not have to be approved and will not be approved. They will just give us feedback.
Hi, Dr. Williams.
Hey, Emily.
I haven't had a chance to look at the plan yet myself either, but a question about education. Where does education stand on the plan? Not only in K through 12, but even higher education.
Yeah. I'm going to let you read the plan to answer that. Again, I'll go back to phase 1. Is we think there's going to be a very limited amount of vaccine, and you'll see following through that. And I've already mentioned kind of healthcare workers and long-term care. But then as we move into phase 2, that gets much broader, thinking we will have a lot more vaccine. And as you read it, I think that'll answer your question. And it's a much more diverse group that's all dependent on how much vaccine we're getting sequentially along this line. Remembering there.
2 more questions.
Remember, there are 4 vaccines out there that are in phase 3 trials at this moment.
All right, 2 more. Andrew and then Rudy.
Sure. So a new poll from the Wall Street Journal and NBC says that more than half of Americans are uncertain on even taking this. There's some reluctance to this. I know you and I spoke last month.
We did.
But how does the state kind of want the public to take this, and how do you encourage the public to get a vaccine that there's so much doubt about?
Yeah, Andrew, thanks so much for the question. So people ask me all the time about that, and the first thing I want to address is safety. You've got to remember that for this vaccine that's now in phase 3 trials, to get to where we're going to get it in December, it has to go through the FDA. And the FDA involves in that process outside stakeholders through national academies. So right off the bat, to even get to the FDA, it has to go through very reputable companies whose scientists have spent their whole life staking their reputations on developing this. Okay, so you've got the companies that are saying, we think this is efficacious and safe. You've got the FDA that thinks, with its outside involvement as well, approving it. And then it goes to an advisory, vaccine advisory immunization committee. And that is a national group. They have to look at the safety and the efficacy. And then once they sign off of it, it has to go to the CDC. And then when the CDC gets it, they do that whole process. So there is an incredibly layered approach involving both private and public entities before anybody will get that vaccine. So the first thing I'd say is we are committed to making sure that it is safe. And then the second part is that we will also look at the efficacy, because there are going to be 4 different vaccines, and we're aware that people will say, well, gosh, if there are 4, how does that fit in? So we are committed to helping Missourians with that as well as these come down through the pipeline. So those would be the 2 things. And then I would just say, Andrew, that, one reason to me this is such an incredibly important day in Missouri is I do think this is our best chance and our best pathway to get to a better place. I really do. So incredibly excited about it.
Dr. Williams, I'd like to follow up on the questions about the dashboard. The Saturday to Wednesday issues weren't the only issues that have come up with the dashboard, right, or the data that the state is providing. Mm-hmm. For example, you have updated death numbers at least 4 times in the last month, right, with more than 300 deaths that were previously unreported. Right. The number of tests you cited just now is the number of total PCR tests, not the number of people who have been tested, which you in May said was the more accurate number. So if you can tell us, once again, what is the level of trust that Missourians should put in that data?
I would say high. Let me address your first question for deaths, because I saw some news articles who said, wait a minute, we had 2 less deaths. How can that be? And again, the complexity of this is that when someone unfortunately passes away, we assign that often to where that happens. So if it's in Columbia at Boone County Hospital, it will get assigned there. But if they actually live in Pettis County, then they'll get assigned there. So during that transition, as that death certificate's getting filled out and we're getting all that information, we can have a situation where it gets duplicated, that we're reporting it from Boone County Hospital or Missouri's hospital, and then later reporting it out in Pettis County. So that's where we run into issues with deaths, where people go, wait a minute, you can't have people dying less. If you had 2 yesterday, you can't have 1 today. But that's the answer there. To the second part of your question, again, what I've tried to do for the last 6 or 7 months is to really encourage you to look at 7-day averages, to really look at those. That's what we do as policymakers. We really, as the governor said, we try to look at 1,400 tests a day as opposed to these momentary data points. Those are important, but we really try to look at trends. Now, to the last thing you said, that has been an issue all along, the duplication of tests, people who get tested twice or 3 times. And that's a constant challenge for us. I'll just be candid with you. And we are always trying to refine our process to reflect actually the number of people who are sick and adjust that for the number of tests, which is really trying to get us to where we want to. Because if one person gets tested 3 times, especially if it's a test of cure, That's really not so important to us. So we are constantly trying to do better with that, and I think we have improved on that.
Thank you, Dr. Williams. Major.
Thank you.
General Compton.
Good afternoon, General. You mentioned the multiple deployments and the National Guardsmen and women working in the food banks, the civil unrest, et cetera. Has the Guard been impacted by COVID-19 in terms of guardsmen and women getting it? And do you have numbers on anything or estimates?
Yeah, it's a great question. I appreciate the question. We have been impacted. We have had positive results. But to guidance from our Secretary of Defense, Office of Secretary of Defense, we're not authorized due to security issues with releasing numbers of our service members that have tested positive. Do appreciate the question, though.
All right, thank you.
Thank you.
All right, Governor Parson. Sebastian?
Hey, Governor. Back in April, you said that you didn't believe it would happen, that people from rural areas would feed into larger cities, hospitals, and stress them and overwhelm them. We're kind of seeing that play out in Springfield to a certain extent, and health providers there have asked for mitigation efforts. They pointed out how Springfield's masking, but most of the surrounding area isn't. Is that something the state could do in terms of mandating masking in an area, even if you're still resistant to doing it statewide?
Yeah, I'm not for sure at the first part of your question. You're recording something I said in April about it wasn't going to happen in rural Missouri, or rural Missourians wasn't going to go to a hospital?
Yeah, you said, quote, do I think just because you live in rural Missouri you're going to flood the hospitals in urban areas? I do not think that.
First of all, I think the only people that's going to go to the hospitals who needs it. I'm not for sure why this is a rural-urban issue. There was a lot of people in the urban areas that went to the hospitals early on, and if you look how the virus has attacked this country, it started in the large urban areas, and you see it spread. We're seeing it spread to rural areas, but I don't know if that's anything that was unexpected, that wasn't going to happen. The hospitals like Southwest region where I'm from, we're limited on the hospitalization that we have down there, much more than a St. Louis or Kansas City or Columbia area would be. So I think when you take all the counties, all the population down there, they're much easier going to be, as we see now in Springfield, that you're going to have more people in those hospitals. But not because of COVID. I mean, it is because of COVID, but you still, whatever the hospital is you're going in there for that service, that's where you go. I don't know that's any surprise to anyone that this is happening in rural Missouri right now. Matter of fact, I'm thankful there's still a lot of counties in this state that doesn't have problems. I'm thankful for that. But there's counties that do, and we have to face that. So I'm not here to blame rural or urban on a virus and how it affects people.
Yes, good afternoon, Governor. The Missouri Veterans Commission says that we've had, I believe, 56 veterans who have died, excuse me, in the veterans' homes, some in hospitals, some in veterans' homes since September. Your reaction to the numbers, and can you update us on the status? You ordered an external review. What is the status of that? Thanks.
Yeah, I sure can. Number one, we were somewhat leading the nation in the way we were taking care of our veterans in this state and our veterans' homes. There was a high spike that we've seen in a couple of veterans' homes that really showed us a red flag that we need to do something. We immediately, once we found that information out, we reached out to the Veterans Commission. We asked for an investigation, and that investigation is taking place or has taken place. We immediately sent in our box-in strategy. We put testing supplies in the veterans to a tune of, I think it's 3,000 that are out there now trying to really take care of that situation. But it was unfortunate that it happened. It was definitely a red flag, the way it happened with what happened in those nursing homes, in those veterans homes. So, again, it was taken action. I also think it's important, too, that we understand that was under a commission, which I do point the commission to that. But by the time we got that, when we got the information, we acted on it day one. When we got the information, we were seeing it was a problem.
Governor, I want to follow up on the question about masks because 7 of the 10 counties with the highest per capita rates for new infection in the past week, and 8 of the 10 that for highest infections so far this month are rural counties with fewer than 25,000 people. Now, I know you said you don't want to mandate masks for the whole state, but do you encourage or would you encourage the local health departments in those high infection areas to mandate masks for their communities?
For 8 months, I've stood up here and recommended for people to wear masks, to do social distancing, clean their hands. For 8 months, everywhere I've made a public plea, I've made that to the local levels ever since up here. I would still encourage to do that, and I always have. I think when you want to get back to the mandate, is where you're headed with that question. The same thing for a vaccine. Do we really want the governor of the state of Missouri to make a mandate that every man, woman, and child be vaccinated? That's the powers you have in this office. That's what's coming up next when this vaccine comes out. I won't do that as governor. I think you have to be very careful in this position, the power you use and when you use it. And again, we've left this up to the local levels. I will continue to support wearing a mask. I'll continue to support social distancing. The problem is this has become such a political issue. The truth of the matter is social distancing is more important. Staying away from large crowds is more important. It's not one of the three, it's all of the three if we're really to take it upon ourselves to make it better in this state. A lot of people are doing everything they can, I believe, every day to Missouri. And I think when you really look at our surrounding states here in the Midwest, you're going to find out Missouri's in better shape, but we're dealing with a virus that no one person has control over.
All right, thank you, Governor.
All right, thank you very much.